This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. So this is another study looking at drugs in cardiac arrest to see if any particular drug is helpful. And this one was looking at calcium. This was done in Denmark, and they basically wanted to know if giving calcium, they did it's a little different dosing, but essentially an amp of calcium chloride with each round of epinephrine for the first 2 rounds of epinephrine during ACLS for cardiac arrest patients. And they randomized them to either get the calcium or just saline placebo, and the primary outcome was to see if there was a better chance of getting ROSC, return of spontaneous circulation. And they had about 400 patients, 200 patients in each arm, and they found that there was no benefit to the calcium, actually like 19% ROSC in the calcium group and 27% in the saline group, and other outcomes like 30-day survival, there was no difference. So, another study showing that, there's no magic drug in cardiac arrest, still epinephrine, which is even questionable at that, but the basic things like good CPR, defibrillation, early access to those things is still kind of what seems to matter, and not worrying about all these other drugs that probably don't have an effect. Questions? All right, thanks guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.